Hi, I'm Mike Morrissey. Every year, a group of 30-plus medical professionals travel to San Lucas Toliman in Guatemala to perform orthopedic surgery on local children. In March of 2019, I joined the team to document their work.
My name's Kihm, and I'm a podiatric surgeon, and I specialize in foot and ankle surgery. On these medical mission trips, we're specializing primarily in clubfoot corrections. Some of the children are too young to be able to manipulate with casting and conservative efforts. So as they get older, the deformity is more rigid and difficult to treat in other ways. So we need to use surgical skills and abilities there. So.
I'm Maggee Sagebiel. I am a registered nurse in the ICU in Louisville, Kentucky. Work not with Carl, but at the same hospital as Carl. And he's the one that kind of brought me here and got me into this.
We met in Louisville, Kentucky, and one of our interests that we share is healthcare. And as we got to know each other, we talked about this medical mission that we've been doing for the last several years. And Steve Miller, who's one of my mentors and has guided me through some of these mission trips, was in town to visit me and met Maggee about a week after we met. And we started to plant the seed that, Maggee was interested in this, and this is something that she's never done. And here we are together almost a year later in Guatemala.
How long have you known Steve?
Steve, let's see, it's been since about 2009, so about 10 years.
How many medical missions?
I've been on most of my missions with Steve, maybe all but two. This is my This is my 9th mission trip, and I've been on about 7 with Steve. And he's been heavily involved, even when he wasn't at the other ones.
What's the big change here that you haven't seen before?
Well, I work in the ICU, so basically any patient, it's nothing like this. My patients are mostly intubated, sedated, surgical patients, cardiac patients, really, really sick people. So adults, yeah, adults.
That's because you're not normally seeing children.
Everything. I never worked with kids ever, so it's my first time working with kids, and it's kids that don't speak Spanish or speak English.
And you speak Spanish?
Not really. I'm trying my best.
What's different here compared to the hospital that you work in Kentucky? Do you have to improvise a lot?
Luckily, everybody got equipment donated. A lot of donated equipment. It's really helped us to the point where we don't really have to improvise very much. We've been really lucky to have pretty much everything that we've needed as far as where I'm working in, like the PACU or pre-op before they go see these guys. So we really haven't had to improvise, no.
And what about you, Carl?
We brought a lot of the resources with us to use while we're here, and also as much as we can to leave here when we go home, so that they'll be able to continue to have some of these resources that maybe they wouldn't naturally have. Regarding the Ponseti, we found that some of these places in the third world don't have access to casting materials to do the Ponseti, for example, even if they know how to do that technique. So we bring what we need for this week, but enough to leave when we go so they can have an impact on what they're learning.
What's the difference here compared to the hospital that you're working at in Kentucky?
Seeing children and young adults with clubfoot here at age 1, 2, 3, 4, up to this year we have a 21-year-old patient. That's not something we typically see back home. We don't typically see somebody with bilateral clubfoot walking around at 21 years old. And we've seen those people in their 40s also. So back home, they're treated with cast manipulation to the point that they don't need surgery, or if they need surgery, it's a minor surgical procedure. That's come a long way. These people with clubfoot used to need 9 surgeries throughout their lifetime. These casting techniques have evolved, and in the United States, it's gotten so good that surgical intervention on adults and young children is not required. So some of these procedures we only do once a year when we come on these medical missions. And through the repetition of doing this for the last decade, we certainly know the techniques and the procedures, but it's thankfully something we don't have to do a lot at home.
How did the two of you end up here together?
Steve, I met him a week after I met Carl, and he said, I want you to come on this trip. It's in a year. And I was like, okay, well, I just met this guy. I don't know if I'm actually gonna, I said, okay, Steve, sounds good. And then here I am a year later, so it's kind of special to like be part of what Steve had said to me just a week after meeting Carl, and just telling me so much about it. So it was kind of special and kind of ironic that I am here now and I like it, yeah.
Things work out when you know you know.
Yeah.
It's special because we work at the same hospital back home, and that's nice. We get to see each other in the middle of the day for lunch. But here we're working side by side in the OR, pre-operatively. I come out of the OR after a 3-4 hour long case, and it's special to see Maggee as the first person that I get to see come out of the OR. So it's been special for her to see what I do, see the impact that we have here, but for us to work side by side with one another too.
Maggee, would you recommend this to other nurses?
Absolutely, yes. And they need more nurses, OR nurses especially, so. But yeah, absolutely. It's a good...
Then what?
Well, we see people back home and that take for granted the healthcare system, and then you come here and it just really kind of amps up the reason why you went into nursing in the first place, to help people, and these are people that need help more than anybody back home. So for the most part, I mean, back home we have all the resources and they don't really have that here, so it's kind of special to see it in a different type of hands. It is definitely opened my eyes. It would open any registered nurse's eyes to just seeing new things and getting a new perspective on the healthcare system and different types of patients.
What do you think you're going to tell your colleagues when you get back home?
I have so many of nurses that I work with are so burnt out, and I think it's because so many nurses are kind of pushed to the breaking point with people. And I think just going here, it just makes me feel so blessed to be there. And like the healthcare, for nurses that are burnt out, this is just, I can't wait to go home and just help people and share my experience and let these nurses know that this is something that anybody can do, just to kind of refresh the reason you went into nursing, and refresh the reason I'm a nurse, and keep me going without going crazy sometimes, because I go crazy back home, yeah.
I went on my first medical mission trip, and it was an incredible experience surgically with the teachers and my attendings that were on the trip, but culturally, spiritually, and these other areas, it's just been life-changing. It's the best thing I've done, and when I talk to people about going on mission trips, I tell them, if you ever get the opportunity, go. You'll never regret it. The perspective of life is different for us than it is in people in the third world particularly, and you never know that unless you're there. And we do our best to tell others what the experience was like, but it's like a special sunset or something. A photo doesn't capture it, and I'm thrilled you guys are making this documentary so we can share this with more people.
Everyone here is a volunteer. Does that create a different work environment compared to your coworkers at home?
Yeah, there are nurses here working from every different level of nursing. PACU, pediatric, NICU, ICU, people in nursing school going. So it's like we have a little bit of everything. We just can help each other in so many ways. They're helping me with like the baby part and helping me grow and learn as a nurse and like see different things. And then we have, I think that's with everyone, we're always learning more things. And then I'm teaching them, when it comes to the big people, so we all have our little things, and it's just helping us grow as people and nurses here.
What about in the OR?
It's been a great special experience also. Steve's been a mentor of mine since I started into podiatry, and Louis Jimenez is one of my attendings also, and 10 years ago he was teaching me the introductions of surgery, and now we continue to work together side by side, and in some ways I teach him things that now I've learned and he continues to teach me. There's some younger residents that we bring on some of these trips, or a fellow. In this case, another podiatrist who hasn't done these type of procedures that we're training. Our goal is to not just give them a crash course in something that they're not going to do when they go home, but when they get interest, that they want to continue to come back year after year and hone in these surgical skills. It's really rewarding. And then in the future, there's enough need out there, they can go maybe in another country and continue on the path of giving back.
Carl, this is your third trip here. Is there a patient that you've seen on all 3 missions?
There's been several patients that we've seen repeatedly. The best part of these trips is at screening day, seeing the patients come back. On the OR table, when we're done, we see the foot position and the correction we achieved, but man, when they come back, we get to see them and hear their story and hear their parents tell us how grateful they are and what their life is now able to allow their child.
Is there one patient that stands out from all the rest?
One special patient that we had is Esther, and she came to us for the first time about 3 years ago, and that was my first mission trip here in Guatemala. I met her and her feet were both turned in and clubbed, and it was just amazing to watch her walk, and it was hard to believe that she could walk. And I think she was 7 years old at the time, and just to understand from her father explaining how that deformity has affected her life was pretty heart-wrenching. We corrected her one club foot the first year, and she came back to us last year and we corrected her other foot. So for the first time, immediately on the post-op scenario, she has 2 straight feet. When she came back this year and we got to see her walking and running and standing, it was just incredible to see that follow through for 3 years here in a row.
And take my whole life too, for